It's better than taking notes.
All right, let's go. So, you should have just not
What's your
told me.
nursing? What's your nursing? It's pretty obvious.
No.
What's your nursing area?
I used to work in home health and hospice.
Oh,
and,
perfect, right.
Yeah, and acute care before that. And
Yeah.
so I've been with IdealLife a couple of years now, and I do all the training with all the case managers that use our software and manage their patients. So I work directly with them in training and then ongoing as they set up their programs and learn how to use our software as their programs grow.
You said a little bit about the company. What is IdealLife? Is it part of a big company or is it a startup? Or
it's a startup. We've been here in business for about 10 years, and we mainly do remote monitoring for health plans and hospital systems, home health agencies. So we help them more effectively manage their patients. So when they can receive real-time information coming through in real time, so when the patient gains a couple pounds, meaning they have fluid on board or their blood pressure goes down or up, they can react proactively and respond to that and take care of it right away. So that way, a couple days later, they don't end up in the ER or in the hospital. So this is what we have. We have a whole suite of devices: blood pressure, weight scales, mainly for heart failure, glucose meter, and pedometer mainly for wellness and weight loss programs, and pulse ox. And all of our devices speak Bluetooth to our gateway, which is right here. It just needs to be plugged in. Landline is fine. No one has to have the internet. If they have Ethernet, that's great too. Or if they don't have either of those, which a lot of elderly people don't these days, they're being frugal and cutting everything out. Then we have cellular. So this one just basically plug it in and cellular. Once that's plugged in, all they have to do is take the reading in the morning, and it transmits through to the cloud. And then the case managers, nurses, whoever's monitoring those patients receive that information in real time and are also notified if they're outside of alert parameters that they've set for them based on their doctor's plan of care. And then they're notified and they can react appropriately.
Is there a consumer version of this?
Not yet, but it's coming in the near future. So eventually we should be able to buy this for our parents and set them up, or we can buy it for ourselves and set ourselves up and monitor our health. Be able to track how we're doing. Maybe if we're diabetic, you can track it by time of day. Take that information in a report to your physician so they can, more effectively prescribe and get you, stabilized.
So who do you sell it to now? Do you sell it to the CMO or the?
Mainly, biggest customer I'd say is like health plans. So health plans that are at full risk, meaning that they're the payer for the patient. So if a patient has, goes back to the hospital 30 days after they've been discharged, that's expensive, and so they identify those patients and offer this program to them because it's going to obviously save them a lot of money. And hospital systems is another growing customer because for the same reason they're penalized if patients are readmitted. So that way, if they can prevent that readmission, they're saving themselves a lot of money.
Sure.
Home care agencies is another, and then we also have programs across the country that are running on grants, studies, people trying to prove the effectiveness of it. A lot of those different programs.
Thank you.
So,
That's great.
Yeah.